Good morning, dear student. On last three class, we studied the interpretation of pathological test or laboratory test reports of patient. Now, today we are going to discuss the laboratory test for lung infection. So, the laboratory test for lung infection, the test includes blood test or culture test. Second is oximetry test. Third is arterial blood gases. Fourth is bronchoscopy. Blood test or culture test. The blood test may help to tell the whether antibodies to a specific organism that can cause pneumonia are present, whether a specific virus such as influenza, flu, respiratory, RSV, syncytial virus are present or not. The doctor can use the blood culture to test for the bacteria in the blood stream. Next is oximetry test. An oximeter can estimate the amount of oxygen in a blood. A sensor in cuff or clip is placed on an end of your finger. This sensor measures how much oxygen in your blood is present. This is oximetry test. Oximeter machine shows the result. Now, third is the arterial blood gases. The arterial blood gases test can measure the level of oxygen in a sample of blood drawn. The arterial blood gases test can measure the level of oxygen in a sample of blood drawn from your artery. Doctor use this test to find out whether the enough oxygen is getting into a blood stream from your lungs or not. Next is related with lungs, the bronchoscopy. The bronchoscopy is a visual examination of tube leading to your lungs. This test is usually done by the respirologist, lungs specialist. He or she insert a small lighted device through your nose and mouth, uh, tube leading to your lungs, and during this test procedure, doctor obtain the sample of tissue fluids, mucus, and also see the inner picture of the lungs by this. These are the laboratory tests for lungs. Now, next test is transtracheal mucus culture. Rarely done, this transtracheal sputum culture are tested performed on a mucus sample obtained directly from your trachea. So this sample taken and cultured in a laboratory to check which kind of infection or which microorganism is responsible for infection. Next text is lungs biopsy. A lungs biopsy is test done on the very small piece of lung tissue to look for the condition such as lungs cancer or fibrous tissue in the lungs in a pulmonary fibrosis. Uh, or in this disease, we can take the small portion of the lungs for the examination. In this test, uh, Doctor obtained lung tissue by inserting a needle into your chest between the two ribs and using the this test also can be done by using the bronchoscopy. So here we are taking the small portion of lungs for the examining whether it is a related with cancer or lungs cancer or fibrosis. Next is thoracentesis. This thoracentesis involve the puncturing of the chest wall to obtain fluid from the space around the lungs. The fluid obtained during this test can be checked for the infection of tuberculosis as well as cancer. This thoracentesis test commonly done when the accumulation of fluid in a outer wall of lungs, and this infection or this happened in the case of tuberculosis. And commonly this if a quantity of liquid is less, then that will be dried by the medicine. If a quantity of liquid is more, then that that is removed by the ABO method uh, for a scientist. Now next is computed tomography, that is called CT scan. A CT scan is used X-ray to produce detailed picture of structure inside your body. It may be used to people who are not responding to their treatment. This case is this test is done on the unconscious patient or very old age patient because they are not uh, able to cooperate for the above mentioned test. So, going for this test, CT scan of the lungs and other part of the body. Next is other blood test. The blood test for infection. Antibodies, sometimes antigen can be measured for the infecting agent. The commonly performed test is aspartame bar virus, toxoplasmosis, cytomegalovirus, streptococcal bacteria, leptospirosis, rubella virus. This test is done on your blood sample. It requires caution to interpreting the test result because the antibody test may be often the indicate past infection, not current infection. So if antibody is present in your blood, that is not a sign you are having the infection of that particular microorganism. That is a sign you have infection earlier or current that particular microorganism. In COVID-19, we are also getting this type of result. A person who is not suffering from COVID-19, but he is having the antibody of that particular virus because that particular COVID-19, because he is directly come in a contact with a person who is infected, and without getting symptoms, he recovered himself by the producing similar or either producing the particular antibody in a blood. And this type of test occur in a or test we can see in a blood sample. Next is a blood culture test. This test is usually carried out as on the urgent test in case of serious infection, and we are not getting the infection hints from the previous test. Uh, so in this test, doctor suspect that the bacteria is multiplying in a blood stream. So he is directly going for the test of blood culture test. The blood test is commonly ordered silently. The serum amylase, follicle stimulating hormones FSH. This serum amylase, this is commonly ordered in case of abdominal pain to see if the pancreas glands is inflamed or its duct is obstructed or not. So serum amylase test is directly related with the pan pancreas condition. Now follicle stimulating hormones test. The sustains high level of FSH in women can indicate that the menopause is approaching or it has happened. So its normal value is 5 to 20 ml unit per ml. Now progesterone level test. Progesterone measurement are often used to determine if the ovulation has occurred. The ovaries produce very small amount of progesterone until the ovulation happen. The normal level is 3 nanogram per milliliter. Per milliliter. Now, SHCG test, that is beta human chronic gonadotropin test. This is the hormone produced in an early pregnancy and is the basis of the urine pregnancy test happened. This is a commonly known as uh, commonly kit is available in market now, and HCG level is less than 5 ml MIU per ml is considered as negative for pregnancy, and if its level is above the 25 MIU value is considered as positive pregnancy test. That is indicated through the lines appeared in a test kit. Now next test is DHEAS test, that is dehydroepiandrosterone. This it is another male hormones that is found in all women's. DHES is the androgen that is secreted by the adrenal gland. It is normal for the woman to have DHES level anywhere between the 35 to 430 microgram per deciliter. Most of the women with PCOS tends to have DHESA level is greater than 200 microgram per deciliter. Particularly, this is a male hormone, but this is also secreted in women in commonly, but its value is ranges from 35 to 430 microgram. Now, prolactin, it is a pituitary hormone that stimulate or sustain the milk production in a nursing mother. The prolactin level are usually normal in women with PCOS, generally less than 25 nanogram per ml. However, it is important to check high prolactin levels in order to rule out the other problems, such as pituitary tumor that might be cause the PCOS level related symptoms. Some women with have PCOS do have elevated prolactin levels, typically falling within a 25 to 40 nanogram per ml. So this is a prolactin lactating mother having the this range. Now, autoimmune disease test. Next test is autoimmune disease are a group of disease where the body's immune system is incorrectly interpret the certain of the its own tissue as a foreign invaders and produce and the immune response to and attack or destroy that particular tissue or had that particular tissue. So this is called autoimmune disease, in which the body organ or body cells is treating as foreign particle. The base known of autoimmune disease is rheumatoid arthritis, where the immune system attack the slippery lubricating lining inside the certain joints. The blood test tried to measure the specific antibodies produced by the body against the specific tissue. Such tests include the rheumatoid factor, lupus anticoagulant test, anti-nuclear antibody test. Next is ESR test, the erythrocyte sedimentation rate. The ESR test is a rate of the RBC settle down or RBC sedimentation rate. It includes here, it is often used to monitor the response of autoimmune disease to treatment. If raised, it any be a general pointer to a infective or inflammatory process going in the body. Particularly, this ESR test is ranges between 5 to 15 mm for normal people, normal person. But if it ranges to more than 15, it is a chances of autoimmune disease. And in the case of tuberculosis patient, this ESR value also increase more than 20, 25, 30 or 40, like that. That value increases in the tuberculosis patient also. Now, some drug assays also done in laboratory. The level of certain drugs can be measured in a serum. The commonly performed drug assay are usually those where the drug has fine line between the toxic and therapeutic range. The common assay includes the serum digoxin level, serum phenytoin, serum theophylline, serum lithium, serum alcohol, and serum lipids. So these tests or this drug assay is done because that drug is having very fine range of therapeutic value and toxic value. This digoxin is responsible or giving as a cardiotonic. Phenytoin is we are giving in the case of epilepsy. Theophylline we are giving in the case of asthma or chronic asthma or asthmatic attack. The serum lithium level, lithium we are giving in the case of psychosis or any mania condition. Serum alcohol, this alcoholic patient, we are checking this test for them, and lipid level, having the cholesterol level high or person who is having high lipid level in the body. Some other common tests, that is disease marker test. The blood test can be monitored the level of certain chemical in a blood as an indicator of the progress of disease. This is an important test. Next one, the best known as PSA. PSA test is prostate specific antigen test. Test which is monitored the prostate cancer. Its value is ranges up to 5, and in the case of prostate cancer, that value increases up to more than 100, 200, 300, like that value increases. Person who is having the history of prostate cancer in his family, his forefather or grandfather or father is having this type of prostate cancer history, then he must go for this test to check whether they are having any kind of prostate cancer progress or not. Or this test very important for the in the case of prostate cancer, and this level should not be exceed from more than 5. The AFP test, alpha fetoprotein, is another this test is used in the treatment of liver cancer. Next is calcium 125 is used to monitor or progress in ovarian cancer. Tissue histology test, that is called FNA test. FNA test is fine needle aspiration. A fine needle of the syringe is inserted in the lesion or the tissue. Negative pressure is applied to suck the some cells for the microscopy. This is usually checked for a tumor cells. In the breast cancer, FNA test is very common to check the small portion of the cells from the tumor uh, by inserting the fine needle in a particular tissue. And similarly, this test also done in a lungs also to take the small portion, small tissues from the lung cells or lungs outer walls. Uh, Excision biopsy test. This is where and the entire lesion is removed or sliced up into the thin section of for the microscopy. That is also done in cancer patient or cancer cell. Now next is biopsy. This is where the small part of the lesion or tissue or the tumor is removed for the microscopy to try and make the diagnosis or find out the cause of the this growth. Next test is microbiological test. Any moist area of the body can be swabbed with a sterile cotton and tipped bud uh, plate out on the agar jelly plate and placed into an incubator to see if bacteria is grow from the swab. That test is going on in COVID-19 also. They are taking the sample by swabbing the uh, sterile cotton through the nose or throat. Once the bacteria have grown, they can identified under the microscope, and the test is test for the sensitivity. The scrapings of the tissue or cuttings of nails can be similarly treated as a uh, for the fungal infection. Uh, if there is a delay between the taking of swab and plating out, it has been stored in a specific transport media or aseptic condition. The sputum is commonly cultured for the bacteria causing the bronchitis, pneumonia, and the tuberculosis. That is commonly done in the case of tuberculosis, the checking or microbial study of the sputum. The feces can be cultured for the bacterial, viral, or parasitic organism. That is also commonly done. Now, next is cytology. Cytology involves the obtaining normal tissue fluid and examining under the microscope of early sign of the cancer cells. Now, STD, sexual transmitted disease blood test, that is VDRL, TPHA test, screening for the syphilis. that is STD disease. Now HIV, this is a screening test for the presence of human immunodeficiency virus antibody in the blood. The herpes test, herpes antibodies test can be measured to access past or present herpes simplex infection. That is also common STD disease, herpes infection. Now, hepatitis antibody and the antigen testing can be includes uh, in the STD test as well as the liver function test. The various types of hepatitis can be contracted by other means as well as sexual transmissions. However, so these tests are related with STD. So these all tests we are generally encountered in a pathological laboratory during any disease, and after the report of this particular test, we can find out the whether the person is suffering from that particular disease or not, or the level of infection or level of disease condition, and um, and after that this interpretation of this test we decide the which kind of treatment going to give for the cure of that particular disease or for the cure of that particular patient. So now our fifth unit, last chapter, also is over today, uh, and our syllabus is completed now, and if you have any doubt you can ask me through chat box, or you can mail me also. Mm, and I think so. In this end of this month, our offline classes will be started. Uh, that government will announce soon regarding the classes of offline classes for the college student. So you have to come to college, and I think so. Your second sessional examination also will be on the basis of offline. Now we have 2 minutes of this session. If you have any queries or question, you can ask me directly.